Epilepsy is a disease of the brain. It is very much treatable if diagnosed in time and if proper therapy has started. Then it is treatable and controllable in almost 70 to 80% of the patients. Though both males and females have almost the same incidence, female with epilepsy has a special features. The woman goes through the various stages of life, small child, adolescent period, then a woman with pregnancy, motherhood. Now all these different phases have a different special management strategy. As a child, of course, the most important part is that her education should not suffer because of epilepsy. If education suffers, everything else in life suffers. Parents must understand that the girl needs to be educated, girl needs to be empowered, and girl needs to excel in many fields in life. Many talents have to be cultivated so that when she grows, epilepsy becomes negligible and her career and her life becomes very, very prosperous. When she is in a adolescent phase, there are certain epilepsies which are more common during perimenstrual phase. There are certain medication which triggers the PCOD in certain females. They may have some menstrual irregularities, and these are the special features which we have to look into when we are treating an adolescent girl with epilepsy. When she is getting married and likely to conceive, we must make sure that we give her a folic acid 5 milligrams daily. And while she is pregnant, there are certain drugs which need to be monitored properly. And the most important, she should not discontinue anti-epileptic drug out of fear that the fetus may suffer because of congenital anomalies. And she has to be reassured, she has to be supported. Her husband and in-laws may need more counseling during this stage. Drug levels, if necessary, needs to be done, and then she has to sail through the pregnancy. As far as possible, the delivery must be in a good medical setup, major hospital. So in case the child has any issue, the NICU can take care. Breastfeeding, of course, must continue. It has to be encouraged. The mother with epilepsy must take care of a child while giving a bath, because sometimes the myoclonic epilepsy is important from that angle. So what I want to say that woman with epilepsy needs to be handled in a much more better manner, and especially when the woman has a stigma, the stigma of epilepsy, stigma for marriage, stigma for pregnancy. This needs counseling. But the most important, empowering a woman with epilepsy. If she is empowered, if she has various talents, if she is financially on her own feet, she should not suffer any disadvantage being a female and having an epilepsy. So empowerment is the most important word for a woman with epilepsy, and counseling at various stages is also required.